Hey everybody, it's me, Nicole. I know I haven't talked to you guys in such a long time. I haven't done a vlog in probably about a month, which is really sad because I told you guys all the things that was kind of coming up for us and then I left you hanging, so I apologize. And I also feel bad for myself because the whole reason that I do these videos is so that I can look back at previous videos and say, oh yeah, that's what I was feeling and what was going on at that certain time and around those certain events. And it's just a shame that I wasn't able to document those events as they happened. I just have not had any time. So, but I did want to update you guys on Sadie's surgery. She had her centralization surgery at the end of July, right before her birthday. And she did amazing. Her arm is straight. And so my husband and I made a slideshow just showing lots of pictures of her arm over the past 2 years, what it looked like when she was first born, what it looked like when she was wearing her splints, before her surgery, and before her first surgery, and then whenever she had the external fixator on, and then before her second surgery, and then finally the results of the second surgery. So it's kind of the whole journey of her arm. So I will link that below so you guys can go check that out so you guys kind of know what I'm talking about. But it's just amazing what doctors can do now. Part of me, when I knew what was going to be happening, whenever I knew that they were going to be taking her arm and fixating it, or not fixating it, but centralizing it on her ulna bone, it was kind of like, almost like a Frankenstein-ish kind of idea for me. You know, I've been so used to having this girl with her hand off at a right angle to her wrist, and Sadie was used to that, and that was just the way that it was for such a long time. And so I knew that the surgery was going to happen, and I knew that at one point she was going to have a straight arm, but for it to actually come to pass and for me to actually be able to look at her arm and see it straight and see it much longer. It is very much longer than it was before. It's longer than I expected it to be. You know, obviously if it was curved before and it's gotten straightened, of course there's going to be a little bit of a difference in length, but it looks completely different. Not to mention it looks a lot thinner because the muscles aren't all bunched up in there, they're stretched out, and it does look thinner too compared to her other arm because there's not as much muscle tone, because she didn't use that arm as much. But it's just it's crazy. She went in the couple of days before the surgery were really tough. It was getting to the point where the pins had been in there, in my opinion, a little bit, getting to the point where it had been in there too long and they were getting loose. And you know, I had told you guys in my previous video that I was kind of upset that they weren't able to schedule the surgery maybe a week or two sooner, but that's life. And you know, her orthopedic surgeon is a very busy man, and that's when they could get her in. But we were really at the end of our rope by the time that the day of the surgery had come. The night before the surgery, she didn't sleep at all. I don't know if she was feeling the excitement or the tension, or if her arm was just bothering her that much, and she was just in that much pain. But you know, the whole 4 months that she had it on, it was no big deal except for when we were cleaning it, and she hated that. But other than that, you know, during the day and running around playing and going through, you know, normal daily routines, she was fine. And then those last couple of days she was just miserable, and then the night before the surgery was really tough. So when the day came for us to, you know, take her into the hospital, get her ready to go, they gave her this elixir before they took her away from us to kind of calm her down and not be so scared to separate from us. And she was in a really good mood. She was like playing drowsy peekaboo. She would like lay her head down on the pillow and like lift it up and look at us, and then she'd lay it down again and lift it up, and she was kind of like laughing and giggling, smiling. And they let her take her blanket back with her, which was really nice. I don't know what they did with it while they were doing surgery. Hopefully they didn't just toss it somewhere, but the whole time she was really in a good mood. So we were blessed in that she wasn't upset or anything like that. So they told us that the surgery was going to be between 3 and 4 hours, and they called us 2 hours later and they were like, hey, she's all done, you guys can, you know, come on back to the waiting area, and she's getting all closed up. So I was kind of worried that they weren't able to do the complete operation. I thought maybe they had just taken off the fixator and they weren't able to centralize it, they weren't able to straighten it. And I asked the nurse, I said, so they weren't able to, you know, do the whole operation? And she said, oh no, everything's done, you're good to go. And so we were really surprised, because beforehand the doctor had told us, you know, it takes about 45 minutes to an hour sometimes to get the anesthesia perfect, and we will not start cutting until the anesthesia is perfect, and then it can take about an hour to an hour and a half for us to get in there and do what we have to do. So for us to get a call 2 hours later, it was crazy, you know. So shortly after that, the surgeon came out and talked to us, and he just looked so happy. You could tell he was just coming out from a place where that was his element, you know. He almost had this sense of, yep, I just did another piece of art, you know, another masterpiece. So it was great to see him, and he actually brought his camera with him, and he had asked us before her first surgery if it was okay for him to take pictures so that he can teach other surgeons as they're coming up, and just so that he has a catalog of all the things that he's done, so that he can teach other people, other hospitals, things like that. And so we were fine with that, and one of the perks was that he was able to take a picture of her arm before they put it in a cast and before they bandaged it all up, but after they had straightened it. So we got to look at her straight arm, which we weren't expecting. We were expecting to have to wait a week until they took the cast off, but he took a picture and we looked at it, and you know, I could tell it was her arm because I know what her fingers look like and I know what her thumb looks like. It's, you know, when you're a mom, you just know when you're looking at your kid. But we couldn't see her body or her face, and there was so much excitement, and it was almost like, it was so surreal. You just couldn't believe it. I'd never seen her arm straight like that ever, and it was so weird but so great. And so we thanked him and shook his hand, and then we were like, okay, when can we see her, you know? So we met up with her a little while after she was able to get out of her anesthesia and things like that, and we hung out in the recovery room for a little while, watched Mickey Mouse, and she had some Jello, and she was happy critter. So we wheeled her out of the hospital in her new buggy car that she had gotten for her birthday from her aunt and her grandma, and we were on our way home. And we expected it to be a rough couple of nights. You know, she had to wear a sling and a cast, so it was definitely going to be tough for her to get used to. And so for about 3 days, her sleep schedule was completely off, and we just kind of rolled with it. We didn't have anything planned for those next couple of days. We had moved her birthday party to before her surgery so that was out of the way, and we didn't have to worry about that, and we just kind of hung out at home with her and did that. So but then, okay, so the surgery was on Tuesday, and then on Friday I was changing her diaper, and I realized that she was having these little bumps down there. And as you guys may know, we've dealt a lot with diaper rash in the past. In fact, that's why one of the main reasons why we cloth diaper now instead of using disposable diapers. So I looked down there and I'm like, well, these are some bumps that I've never seen before. I've never seen this kind of rash before. It could be because, you know, now we're using cloth diapers and, you know, all the stress and everything. Maybe it's that, I don't know, but I just didn't feel comfortable with it. So I called her primary care physician and talked to her about it, and she said, why don't you come in? So we went in the next morning. It was Saturday morning. They took a couple swabs of the area, and the doctor had said, you know, it looks a little bit like a skin infection, so I'll take these swabs. In the meantime, take this ointment and put it on her 3 times a day. So, you know, I didn't think anything of it. We went home, we started using the ointment 3 times a day, and then Tuesday we got a phone call from the nurse, and Robert had answered the phone, and she told him, you know, okay, the swab came back and she's positive for MRSA. And so Robert's like, okay, yeah, you know, and so they told him, you have to call the hospital, let them know that she contracted MRSA, and, you know, if they need anything, and if they need any information or anything like that, to let us know. Otherwise, just continue using the ointment and let us know if anything gets any worse. So he hung up with them, and then he told me, and I'm like, what's MRSA, you know? So then we go and we start Googling, and the information really freaked us out, you know, because they were talking about how MRSA gets into your blood and can cause you to have pneumonia and all this stuff, and it was really, really scary. And we were getting kind of like mixed information about it from different sites on the internet. So I just called the doctor back, and first I called Shriners and I let them know, you know, hey, she got MRSA, so, you know, do what you guys have to do on your end. And so they let us know. They said, okay, she's gonna have to wear a mask next time she comes in, and if she can't wear the mask, if she won't put up with it, then we'll have to all wear masks and probably gowns and gloves. And so I figured, you know, probably no big deal. And so then after I talked to them, I kind of got even more worried, and I was just festering on it. So I called her primary care physician back, and I talked to the nurse again about it. I'm like, I just want to know what's going on. And she's like, oh, you know, as soon as the rash goes away, she's done with it, you know, just make sure it's not getting any worse. Let us know if she gets a fever or anything like that, but the ointment should take care of it and she should be fine. So yeah, but then we talked to the people at the hospital again, and they had told us that she will from now on be treated as a MRSA patient, because once you have MRSA, you really never get rid of it. So I got completely confused, and I called back the doctor again, and I'm like, okay, this is what the hospital told me. And so then the nurse was like, yeah, well, that's what they say, because hospitals are really, really scared of MRSA. And if you don't, did I mention what MRSA is? If you don't know what MRSA is, it's like a strain of staph infection. And really, the main places that you would get a staph infection or a MRSA infection is from, sorry if it got really, really dark, the clouds just came in, is in a hospital. So, or like a retirement home, or possibly in a daycare. And we haven't gone to a retirement home recently, and we don't put Sadie in daycare, so I'm pretty sure that she got it at the hospital. But anyways, the nurse told us, you know, the hospitals are really, really scared of MRSA. They don't mess with it, and they don't want to take any chances. So, so that's what she said about them having differing stories. So if you guys have ever dealt with MRSA or know anything about it, if you're a nurse or a doctor or anything like that, go ahead and leave in the comments below what you guys know about it, because all the information on the internet is kind of like crazy anyways. But yeah, I don't get it. My main goal, I guess, right now, and what I'm fixed on is getting that rash cleared up and her not having to deal with it anymore. We're about a week and a half into using the ointment, and it's doing a lot better. It's all the same skin tone, it's all the same flesh tone, but there's still little bumps from where the big bumps used to be. So yeah, but that's the update on that. I hope you guys enjoyed, and I will try to keep you guys more updated in the future. So until next time, see you later.